In this lesson, I will explain the physiological changes that occur in a pregnancy and hopefully make it more understandable. So let's first start and define what exactly this all means. So physiological changes are going to be not physical. So it is changes that occur to the body's function, so not physical. The changes are going to be normal, okay? So they're all normal, they're expected, and it's mainly caused by hormones, and those hormones are HCG, estrogen, progesterone, and aldosterone is another big one. Now there's other hormones, of course, but these are the main ones that cause these physiological changes to occur. Also, we have an expanding uterus that's taken up a lot of room in there, right? And then we have an increase in blood volume that causes a lot of these physiological changes. And we'll talk about more about that and all those different effects. And then also these physiological changes are affecting multiple systems. So we have the cardiac system, respiratory, musculoskeletal are the big ones here. Our gastrointestinal and our renal system. And we'll break down and talk about these in more detail. So for our assessment piece, we want to do a head-to-toe assessment on this patient. We need to look for the changes, see what changes are occurring, and make sure that she understands what's going on. The patient should also be interviewed to see what changes has she noticed. And then we also need to ask her what kind of concerns does she have. So, some of these concerns can cause patients to be really lightheaded and dizzy. So we just want to make sure that she's aware and we can address these concerns for her. So for our physiological changes with all these different things, so the hormones, it's important to know the ones that are involved. So let's go through and what they do. Estrogen, progesterone, HCG, and aldosterone. Estrogen is going to be really responsible for an increase in vascularity. So this causes a lot of congestion to happen, like nasal stuffiness. So that's going to be caused by estrogen. Progesterone is slowing everything down, okay? So progesterone is what really maintains a pregnancy. It's going to slow down and cause that uterus to not contract because we want to maintain that the pregnancy and keep the body pregnant. So because it slows everything down, it's also going to affect the GI system because you can't slow down one system without slowing down others. So our GI system slows down. So we're going to have some nausea and vomiting because of that, heartburn, and then also the big one is constipation with pregnancy. So that is all from progesterone. HCG is the hormone that is detected on pregnancy tests, and this is going to be increasing very quickly. So rapid increase every 2 to 3 days, it's doubling or tripling in numbers. And of course, it's going to increase more if there's twins. So this is going to really cause nausea and vomiting because the body is trying to adjust to all this increase in hormones. So that's HCG. And then aldosterone, this one is going to increase the blood plasma volume. So with this increase, we have, it'll be more work for the heart because there's an increased volume. So more work, but it's going to be helpful after we've had a baby to have that extra volume there because you're bleeding heavier after the delivery. And we'll go more into that when we get to the cardiovascular system. So for our respiratory system, it changes because we have an increase in oxygen consumption, and then we have that nasal congestion that I mentioned. So it is common for these patients to have stuffiness, so nasal congestion, and then also nosebleeds are going to be common because of this increased vascularity there. Then for our GI system, remember everything slows down. So this patient is, do you remember what hormone? Let's just review. It's going to be progesterone, right? So slowing everything down. So this is going to cause our constipation, and that nausea and vomiting like we talked about. And then a really bad bloating feeling is also going to happen because everything slows down and the woman can feel really bloated. Then for our renal system, so the patient's going to have frequent urination, and some people are really surprised, so this can actually be a frequent test question. It's important to know that that frequent urination really starts early in pregnancy, and it'll slow down and then pick up again toward the end, but it is not uncommon in that first trimester to already have frequent urination happening. So we have the weight of the uterus starting to grow, and it's going to press on that bladder, making urination more common because it can't fill up as much. And then also those rising hormone levels can cause it. Now these patients, because of this, with the uterus, the way it presses, it can block some of those vessels and or not block the vessels, I'm sorry, but be blocked so that the urine is not draining into the bladder correctly or as well, and you're not able to release the urine as well. So because of this, frequent UTIs are common. And so women need to be watched closely for that and make sure that they're fully emptying their bladder and that they're not getting a UTI. So you can see in this picture how there is a small area to grow a baby, and this causes the respiratory system is going to get pushed up and crunched, and the GI system is going to be bothered easily. And then also with aldosterone increasing and those plasma levels increase, we don't have good blood return coming back to the heart, and so hypotension is a frequent problem. And we'll talk about that on the next slide with cardiovascular in more detail. So here with our cardiovascular system, so the cardiovascular system has a lot of changes happening. We have an increase in blood volume that's happened because of the aldosterone increasing that plasma level. And then also this picture is going to kind of give a better visual of this. So we have the increasing volume, we have more plasma, more red blood cells. And then in the third trimester, we have our plasmas increased a lot. The red blood cells have increased, not quite as much, but have increased. And so this is going to cause, because of this, the hematocrit's going to go down. And we're going to have some physiological anemia of pregnancy. So just something to watch for these patients. Now, because of all these volume changes, we might hear murmurs on these patients. So this can be asked sometimes on test questions, something you would report or that's abnormal, shouldn't be expected. Murmurs are something, and that can trip people up. So murmurs can be normal because of this extra blood volume. Edema is another thing that's going to happen because of the increased swelling. And that can also happen. They can start retaining that extra fluid and feeling a little puffy early on in the pregnancy. And then our heart rate is going to increase 10 to 15 beats per minute is usually the expected. And then our blood pressure is going to be reduced. And that is going to be usually in the second trimester that it'll be kind of at its lowest point, sometime in the middle there. These changes, because of all that, can cause a little bit of a lightheaded feeling, and of course passing out can sometimes happen. So we need to make sure this patient's not just jumping up out of bed, and be helpful to her to, move slowly, because what happens is when you're sitting, all that blood pools down in those little feet, right? So the blood's pooling down there, they jump up, and then that blood can't get up there and they pass out. So that is a common thing. The other thing with these patients, we don't want them to lay flat on their backs ever, because when they're flat on their back, we have that uterus and it's pressing on all those veins and the blood can't get back up. And it's called supine hypotension syndrome. And so for these, or for all pregnant patients, not just a few, all of them, they should never lay flat on their back. They should always be side lying. And the left side is going to be the left side for blood return. We just obviously want good blood flow to get to the mom, because that means good blood flow is getting to the baby. All right, so for our musculoskeletal system, we have a lot of changes with gait and posture happening. We have a hormone that's actually called relaxin. And that relaxin hormone starts to relax everything. And so everything stretches out and moves, makes room for that baby to come through. So these changes cause that wobbling gait to happen. Also, we have posture changes. So for a patient, we see that lumbar lordosis. I'll write that. Lumbar lordosis. And that is where you have your pregnant patient, her back is going to kind of cave in with that pregnancy, okay? It's trying to regain that center of gravity and that balance. And then for our hematologic system, coags, so this is huge. We have an increase in our coags, and that's needed. Why would that be needed? Well, we're going to need more clotting because we're going to bleed a lot after that baby's born. And so it's super helpful to have extra clotting factors. But for these pregnant patients, we're going to be worried about an increased risk of DVTs because of the clotting factor. So they're at an increased risk for DVTs. There is not much therapeutic management, so we want to treat any discomfort that this patient might have to help. So one way of doing this would be a belly band. So a belly band is a band that goes around the abdomen and literally lifts that belly up. So it just is some extra back support. So especially people that are carrying multiples or people that have had multiple babies, it's going to be helpful because those muscles are sort of a little bit more stretched out in someone that's had a child before. So just belly bands to help with that back discomfort. Medications for GI discomfort. There's a lot of over-the-counter meds that we can help suggest for these patients. So if they're really nausea and vomiting, they might need a prescription for ondansetron or Zofran to be given for that patient. We can also tell that patient to eat, so for diet changes, eat small frequent meals. And that's because the belly that way always has food on it and doesn't get too nauseous, but also just to help so we don't get too full and cause that nausea to get worse or the bloating feeling to get worse. It's important for education that they know that these are all normal changes, okay? They know lots of changes are going to happen. You know, people don't really talk about that as much to people. You just talk about having the baby. So they don't know what to expect. So make sure they know what to expect. And then what they can do to improve their symptoms, like improve the nausea, like those small meals, small frequent meals. Nausea is a big complaint. So another good thing to suggest to a patient or educate is to eat something before rising out of bed. So just have some crackers by the nightstand on the table, have those before they rise out of bed. And don't let the stomach get empty. So don't get empty. Sometimes if that stomach gets empty, then we are going to increase our nausea, and then they're so nauseous that they don't feel like eating. So we want to keep a little food on it, which is why those small frequent meals can be helpful. And then it's also important to make sure the patient is having good posture, and we're promoting that to help with back pain, or to relieve back pain, I should say. And then also we want to tell them when to be concerned, what to worry about, the signs to call about. So things like if they're having a ton of vomiting, they can't keep any food down, that's going to be something we would want them to let us know about. So we make sure that they're staying hydrated as well. Especially if it's causing weight loss. Signs and symptoms of blood clots, since they are at increased risk for this. So blood clots and DVTs, and then UTIs, that they need to be mindful that that is a common thing that can happen to them. So just to be aware of those symptoms. For our nursing concepts, reproduction will be a concept because the pregnancy is causing these physiological changes to occur. And then hormonal regulation, because the hormones are a big cause of some of these changes that are occurring. So our key points, just to kind of wrap it all up and make sure everything is more clear, is that the hormones. So the hormones are mainly estrogen, progesterone, HCG, and aldosterone that are causing these changes. The expansion of the uterus is going to be affecting the musculoskeletal system and the respiratory system because we're swishing everything up there. And then with the respiratory system, we have an increase in oxygen consumption happening. And then remember the stuffiness that occurs and is normal. And then our circulating blood volume. So it increases, right? It goes up. So those are cardiovascular changes that occur. So for this, we have the hypotension is very common, as well as the anemia. And then normal is the last thing, right? All these changes are normal pregnancy changes, and we just need to help the patient be aware and then symptom manage as we can. Make sure you check out the resources that are attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.